And now I'm going to share my screen. Okay. Oops, I didn't mean to do that. Oh, stop it, stop it, stop it. Okay. All right, everyone. Good afternoon. Welcome. Welcome to the healthcare, Temple Healthcare interest meeting. My name is Alexis Bradford. I'm with the Real World Learning Department here at Vaux. Nina is also in the building as well. I think you're still here, Nina. I can't see who's here. Okay.
I'm here.
Okay. She's our Real World Learning Director over at El Centro. Sorry, I'm trying to figure this thing out. Here we go. Oh my goodness, this is not the right one. I'm so sorry. Nita, do you think you can quickly share the interest meeting? Because I had the wrong one.
Yeah, let me see if I can grab it. I should have it.
Okay. You know what? I'm going to stop recording. Okay. I'm so sorry. I've already reviewed meeting norms. Students, can you please introduce yourself? I'm just going to select as I see on my screen. So the first person that I see is Lena. Can you please introduce yourself?
Okay. Hello, my name is Angelina Cruz. I go to El Centro de Estudiantes and I'm in 12th grade.
Awesome. Who's next? Dayani.
Hello, my name is Dayani. Pleasure to meet you. I go
Hey.
to Volta School and I'm in 11th grade.
Thank you. Sanai.
Hi, my name is Sanaya Bradley. I go to Vaux and I'm in 10th grade.
Nice meeting you. Betty, please. Okay, not too sure where Betty is. Nashe.
My name is Nashe Walker. I go to Vulture Picture High School and I'm a senior.
Awesome. Kayla.
Hi, my name is Kaylin Neild. I go to El Centro and I'm in 12th grade.
Pleasure. Shatira.
My name is Shatira and I go to Boston Picture High School and I'm in 11th grade.
Thank you. Julie Reese. Forgive me if I pronounced your name incorrectly. Okay. Julie, are you still there?
I think she said her audio is not working, but
Got
Julie,
you.
can you type your intro in the chat for people so we know who you are?
This is okay. Let me see the chat. Okay, did I get everyone? Okay, I think I got everyone that could speak. Great. Okay. And Brenda.
Hi.
Hi. Okay, so now I'm going to attempt to make you co-host,
Okay.
and it will be your show. Um, I'm going to stop sharing at the moment.
I got a question.
Sure.
So Miss Tia was telling me that it's different healthcares. So is this the one like the one with the medical stuff, or is this the healthcare with the nutritions?
This is going to be medical.
Okay. Because it said nutrition on here, but I was just making sure.
Um, you you can join in, and then you can feel free to come to tomorrow's as well. I mean, on Thursdays as well. Okay? If
Is
it's
that a
not, if
different
it
one?
doesn't meet you, if this is not the one that you were thinking that it was.
No, I don't want to be in a nutrition one. I want to be in a medical one. Medical.
Okay. Okay.
So
Okay,
this the right
yes.
one? Okay. Thank you.
Mm-hmm. Okay, bear with me. Stop. All right, where did she go? Oh, here we go. Brenda. Okay, Brenda.
Okay. I just want to say hello to everybody. And I just had an eye procedure done. That's why my video is off. So I'll say hello, everybody. I just want to turn it back on for a moment. So hi, everybody. I know some of you from Vox. We've been there with the Temple nursing students. I'm just going to keep my video off so I don't have to keep this compress on my eye the whole time so you don't have to see it. It's ugly. But I just wanted to say hello to everybody. So this semester we have the nursing students, the Temple nursing students. They're in junior and senior year, and they made a presentation for you, so I'm going to play that in a moment. And what's going to happen this semester is we're going to be providing some like mentoring through your internship on Zoom. And we meet on Wednesdays and Fridays, so it's a little bit different. I'm not sure if Tia explained it to everybody, but my students will be making videos about different health topics for you to watch on Tuesday and Thursday. And then on Wednesday and Friday, you're going to be given time to come on with us, and we'll help you through your project and the internship. So that's how it would work this semester, and probably next semester too, I'm assuming, in the springtime. So I'm going to share my screen, and I'm going to, let me just pull this up. So I don't see my students on Tuesdays, so that's why they made this video for you. All right. Can everybody see this video? Hopefully the sound will work.
Yes.
Okay, great. All right, I'm sorry?
I saw I can see it.
Okay, great. So I'm going to play it. They're going to explain why they came into the nursing field, and then they're also going to talk about some things that they've seen in clinical so far. So they have, in addition to their nursing classes, they go to the hospital, and they spend a whole shift in there. It's either 6 hours or 12-hour shift, and they are partnered up with a nurse. So they're just going to go over some different patients they've seen. I'm going to play that now.
Junior nursing students. We are just here to tell you about our experiences in nursing, why we started nursing, and hopefully get you interested within the field. And I hope that you find this video very informational. Thank you. For me personally, I have always been interested within the medical field, but I wasn't sure exactly what. So
The video is lagging, like you can't really see it.
Out of a bunch of different
Like it's skipping.
related professions, became
It's skipping. Can you hear it okay? Let me just.
Like is the video in her talking? It's like skipping.
Okay. Sorry. All right, let me just try something. Not coming on.
Came across nursing. A lot of times, many professions, they're very open to you doing this as long as you ask.
I'm sorry, I'm having lots of trouble with this now. I'm just going to talk about, well, I'm trying to get this up. I really apologize. I had it all set up for you guys. I'm just going to talk about my nursing career while I'm trying to get this up here. So nursing, it wasn't my first choice to go into. I actually wanted to go into law, and I became a paralegal first. And then I wanted something where I was more hands-on, where I could help people. I didn't like law at all. I didn't like the paralegal field. I wanted to help people more. I wanted to do stuff hands-on. So I decided to go into nursing. There's a lot of different areas in nursing that you can go into, and I liked that aspect of it because I get bored very easy with stuff. So I like that you could choose to work with like adults, you could work with kids, you could work with women's health, you could work in outpatient clinical settings like urgent cares. They actually weren't around when I did it, but different doctor's offices you could work at. You could national parks hire nurses. There's just like, it's a very big field. You can just different companies, they hire occupational nurses. So it's a really just diverse field to go into. I went into travel nursing, which they send you to different states across the country. You can go all 50 states, Hawaii, Puerto Rico. I went to California, and I stayed out there for 3 years and worked as a nurse through this travel company. I also have done home care. I've done infusion nursing, where I work with a lot of cancer patients, and I really enjoyed that. It was outside the hospital setting, so that was one thing I didn't like about when I was in the law field. I didn't like being in that office all day. And it was kind of the same thing with the hospital. I didn't want to be in the hospital all day. So I really liked the home care. And I also did home hospice, which I enjoyed. And it was a lot of dealing with family, dealing with death, getting people, really talking about death. And it's just a very different aspect of nursing than when I first started. So that I really enjoyed a lot. It did wear you down because I had tons of people dying, and it does wear you down eventually, but I really enjoyed it. And then I got into teaching. Okay, so I just got the video back up again. I'm going to give it another try. I hope this works.
Hi everyone, my name is Emily, and the following videos will all be junior nursing students. We are just here to tell you about our experiences in nursing, why we started nursing, and hopefully get you interested within the field. And I hope that you find this video very informational. Thank you. For me personally, I have always been interested within the medical field, but I wasn't sure exactly what. So I came into the nursing program because before my senior year in high school, I shadowed a bunch of different medical related professions and came across nursing. A lot of times, many professions, they're very open to you doing this as long as you ask. I've enjoyed the program a lot, and I've learned many things, both about the emotional side of human interaction and how to help people in a therapeutic way, but also understanding more about the human body, how it works, and different drug interactions. So say like a medication that you take, how it may affect another type that you take. For me, I think a huge experience I had was during clinical last semester. I've always been pretty good at the physical side of things, understanding the medicine, the diseases, and things like that. But I've had a lot that I learned about the emotional side of caring for patients. One day I was dealing with a mother of 2 children who were present in the room. Both the children were adults at the time that I saw them, but their mother had been in a coma and they weren't expecting her to wake up. and she had an order for something called do not resuscitate. So basically, if her heart were to stop, we were told not to restart it. And I was doing something simple where I was just getting a finger prick so that I could test something called her blood glucose level. This is just to see how much sugar is within your blood. And for me, it was a very interesting experience walking into the room with two children who had already accepted the fact that their mother was probably not coming back to them, and then having to take a finger prick of them. And it was a very emotional experience for me. But I think I learned a lot about how to deal with the job emotionally myself. And it was just something that was very interesting to me because I had never experienced a situation like that in my life. To see how others were coping with it was something I gained a lot of perspective from.
Hi, I'm Haley. I joined nursing because it's kind of something that I always wanted to do ever since I was probably about 8 years old. I was never sure why I really wanted to do it. I just knew it was something that had to be done. And when I was in 6th grade, my dad got diagnosed with lung cancer and was at the hospital at the University of Pennsylvania. He was in it for Christmas, and when I would go down to visit him on Christmas with my grandparents, I would watch as the nurses would take care of him and help him to get better. It was then that I realized that I wanted to be a nurse when I grew up, to be able to help others the way that those nurses were able to help my dad. One of my cool clinical experiences was on the medical surgical unit, and I was able to insert a catheter into a woman, and I was able to also insert a PureWay catheter into a woman, which is just an external catheter and kind of looks like a banana. This was interesting because in nursing school you don't really learn how to insert those until probably your junior or senior year. And it was interesting just to be able to get a little head start on what it's all about. And, yeah.
Oh, she's must be muted. Let me
Pros about nursing. There's many aspects to it, so many different fields, specialties, and you can go into, so there's something whatever you find that would be of interest. You also know that you're not going to stuck in the same job or position for your whole career. You can always switch things up. There's flexibility in where you work, not just in one job, which is great. And then the cool experience I had so far in my clinicals as a student in this last semester on my med surg floor. I had a whole opportunity to give medications to my patient orally instead of subcutaneously, which is via the skin, where you have to sterilize the area and insert the injection.
Brenda?
yes.
This particular student talking is very, very low, just so you know.
Okay.
The reason for this is because the
Let me see if I can just skip over her.
They can't have anything by mouth. They can't.
It's as loud as I can make it.
And so a patient had end-stage renal disease, which is when the kidneys are completely failing.
My name is Charles. I'm a junior nursing student at Temple, and I joined nursing because when I was a kid, I had to have surgery. And I don't remember talking to the doctors that much, but I do remember talking to the nurses, and they made sure I was comfortable. And as a kid, having surgery is kind of scary. So they made sure I was all right and answered any questions I had, and I trusted them that they were taking the best care of me that they could. And also growing up, my mom's a nurse, so she always told me stories about nursing and what stuff she had to do, and it kind of piqued my interest as a child. And when I grew up, I felt that some profession, the healthcare field would be best for me, so I chose nursing. It's really flexible and you can branch out and do a lot of things with it. So in clinical, you see a lot of patients and it's different every time. And I remember in class we learned about diabetes, and then in the clinical setting I had a patient who actually had diabetes, so it was cool that I was able to apply something that I learned in class into the clinical setting. And it makes you think of like all the symptoms, all the medications they're on, and it's satisfying to know that something that you learn in class and in lecture is something you actually really have to apply when you're working in your real job. So I thought that was always cool. Also, nursing is a profession where you're always on your feet and you're always using your head to make sure you're taking the best care of your patient. And I thought that's very satisfying. And also, there's a lot of things you can do in nursing. No matter what you wanted to do first, you could always branch out and do whatever you want. So it's a very flexible thing, and it's satisfying because you're taking care of someone with real problems and real issues, and you're trying your best to make them feel better. And at the end of the day, that makes you feel good.
Hi everyone, my name is Briette. I am a junior nursing major at Temple University. I wanted to get into nursing. So my high school did a program my senior year for the hospital that was located right next door to us. So I was able to shadow all the healthcare workers, doctors, nurses, even like people who work in the laboratory. I shadowed OR. It was a lot of fun. But I enjoyed being with nurses the most out of my time there. They were the ones who were most hands-on with the patients. They were the most interactive with the patients. They're the ones who know the most, guiding them throughout their recovery process. So that's a lot of fun, and I find great satisfaction in helping others. So I knew nursing would be a great profession for me. My clinical experience at Temple has been fun. Right now I'm doing psych nursing at Episcopal Hospital, which is a Temple branch hospital too. But I've only been there for 2 to 3 weeks, so I haven't had a lot of action yet. But I did have clinical at Temple Hospital last semester, and it was a lot of fun. I had one patient who was about to get discharged the day that I was there. So he came back to his room for after a biopsy, and the nurse gave him food to eat. And yeah, so I was having a conversation with him, and then suddenly he complained of chest pain. So I went to get the nurse, and we both thought that the chest pain was just him eating too fast. So the acid reflux was just what was causing his chest to hurt a little bit because he hasn't eaten actual food for a couple of days. But so we waited it out with him, and he eventually complained about it getting worse, and it wasn't getting any better. So the nurse came in to do vital signs on him. So she took his pulse ox, his blood pressure, and his temperature and all that. So his heart rate did go up, and his pulse ox was a little lower than usual since the last time. So yeah, she went to run an EKG on him. Found out that something was definitely wrong with his heart. So his chest pain was basically coming from a heart attack, an onset heart attack.
We started doing it. Do you mind? I said, who started doing that shit? Like, you know, start doing that shit to lose us. My grandma too.
Wait, I have to mute someone.
At a time. Yeah, I was.
I'm sorry for the noise. Nisha, please mute yourself.
An ultrasound of the heart. So they found out that one of the valves were not closing properly, so it was causing regurgitation. He was basically having an onset.
All right, I'm just gonna pause it. I'm just getting some messages saying that it's glitching again, so I apologize for that. So I have more students, they all talk about it. I'm just gonna pause it and just see if you guys have any questions, and I can share more about the nursing program with you. Does anybody have any questions so far about what the students were talking about? Or about the nursing field?
Don't be shy.
I'm going to turn my video on. I just have my little eye problem, but I just want you guys to feel free to talk. Lena, you unmuted yourself. Do you have any?
Yeah, I don't have a question about the students. I like understood all that and where that was coming from, but I have a question for you. So can you tell me like what a typical day looks like in like for you at your job?
Sure. So so I've had a lot of different nursing careers. When I'll tell you about the hospital.
Mhm.
And I said before, I get really bored at jobs, so I love switching around. So I really have switched around in my nursing career. In the hospital, typically you work 12-hour shifts now. They've pretty much changed everybody to a 12-hour shift. So that would be like 7 to 7:30, 12 and a half hours. You get that little lunch in there. So you either do the day shift or night shift. Hospitals are open 24 hours, so you're always going to have nurses working overnight. So if you're a night person, go for it. I hated night shift myself, but some nurses love it. I've always worked 7 to 7:30. So I would come in at 7, and the first thing you get your assignment. So you have, maybe 15 patients on the floor, and there's all different floors in a hospital. There's heart floors, general med surg floors. I worked on a telemetry floor, which is a cardiac heart floor mainly. So we would have so many patients. I would be assigned to maybe 4 patients for my shift. So I would get my assignment. I would look my patients up in the computer. Everything's electronic now, which is great. I would talk to the shift, whoever had the patients at nighttime, and find out why the person came in. What procedures are they going for today? Are they going for any operations that they need something special done for? I'd get that report. Usually lasts for about a half hours. Then you would go in and get all your vital signs on the patient, and you kind of see what needs to be done immediately with your patients. You have, so many different patients, so you got to figure out what you have to do first. And then you just go get your meds, get people ready to go to procedures, to X-ray or down to operation, and get new orders from the doctors. And there's a lot of different people, a lot of different other medical professionals on the floor. So maybe there's physical therapy coming in to see your patient. There might be social work coming in. There's lots of different doctors. They don't just get one. They might have a heart doctor. They might have a general family med doctor. They might have an oncologist. Maybe they have a pulmonologist who's a lung doctor. So one patient can have 5 different doctors that you're talking to throughout the day. And I've always had great experience with doctors. They've been really nice talking to nurses, because you're there at the patients all day. And, you're there getting them breakfast, lunch, and dinner. You're there getting them up out of bed, helping them. So it's a lot of service work that you're doing. It's not just, there's also aides on the floor that bathe the people, which is great. They're a huge help, the aides. But the nurse still, sometimes aides get busy. So the nurse might have to bathe the person. Sometimes dietary comes in, they'll, put down the breakfast, lunch, or dinner tray, and then maybe you as a nurse have to feed the patient. So it's not all just, giving the medicine, doing this. You're also doing a lot of service stuff.
Okay. That was my only question. Thank you.
And that's just in the hospital. Like I said, there's, when I did home infusions, my day would look totally different. I would get my assignment usually the night before, and I would see so many patients a day, maybe like 5 patients a day throughout Philadelphia, Bucks County. And I'd drive to their homes, and I would do an antibiotic infusion, or I would draw blood, or there's some infusions that you have to sit with the patient for 5 hours. So, you bring a book or knitting with you or something, talk with the patient. But so that was a totally different type of day. But and then hospice too, when I did home hospice, that was different also. And there's different people involved in that kind of care. There's chaplains, there's pastors, social work's a huge deal in hospice. So lots of different, I just think you can't, you should never hear a nurse say they're bored, because there's so many different fields you can just go somewhere else. Any other questions? Anything that, yeah.
I wanted to ask, well, does everyone, the word clinical was used a few times, and I was wondering if everyone had clarity on what the term clinical meant in a nursing, in a nursing setting.
So so for the nursing students, we have a clinical that they go to. So it's actually like, it's one of their classes. So they're clinical for students. They would go to the hospital clinical, or they would go to the psych, I think the one student said she had a psych clinical right now. So she goes to, I think she said Einstein. We have like 3 different psych hospitals. I was never a psych nurse. So I'm not sure exactly what type of stuff they do. I know it's a lot of talking and a lot of therapy, sit down with the patients, more so than doing medical care. And, some people like that. They don't want to see the blood. They don't want to do wounds. They want to more talk with people, like that kind of therapy. Same thing with addiction nursing. That's another big field for nursing. I'm getting off the topic, sorry, I'm clinical. But addiction nursing, that's drug and alcohol. And nurses go into that field, and you don't do all the wound care, blood, but you do more therapy, and nurses are involved in that. Back to your question, so clinicals for our students, that's what that is, the hospital clinical, psych clinical. They go to labor and delivery clinicals, so they would take a whole shift wherever their clinical site is.
Great.
Mm-hmm. And our program is a bachelor program. So you, at Temple, most, even if you do decide to be a nurse, bachelor degree is what you want to go for. There's very few associate degree programs out there. There are some, but I think all of the hospitals in our area in Pennsylvania and New Jersey require you to have your bachelor degree. You can have an associate degree, be an RN, a nurse, but you'll be working in different areas, not in the hospital. You would work in prison nurses hire associate degree nurses, a lot of outpatient facilities, such as like the doctor's offices. They'll hire associate degree nurses, urgent care, they'll hire them. But bachelor degree is something that you want to get to, just to give you more flexibility.
Can you talk a little bit about the difference between LPN, what LPN, BSN, like having a BSN, and then I guess just regular RN?
Yeah, so an LPN is a licensed practical nurse. So that's I believe it's a 2-year program. What I am and what the students are in is an RN program. So it's a registered nurse. So LPN is a licensed practical nurse. They do almost what an RN would do in the hospital, except for they cannot take doctor's orders. They can't give IV medicine. They can give pills to the patient, but they can't give IVs. They can't put in IVs. So when you see people with those little like peripheral IVs, they call them, in their arm or in their hand, RNs can put them in, but LPNs can't. Most hospitals, they go back and forth every like 5 years. They always say they're going to do away with LPNs in the hospital, and they bring them out. Most LPNs work in senior centers, long-term care facilities. So they have their own like floor. They do the whole unit. I don't know how they do it. It's really hard. But they have everybody on there. That just amazes me. And then there'll be an RN who is over that whole unit, and different LPNs. So if you see LPNs, there's usually an RN over them. And then, so the BSN, that's the bachelor degree nursing. So if you're an associate degree nurse, you're an RN. If you're a bachelor degree nurse, you can then put BSN next to your name. That's all. It means you have the bachelor degree. And then you go on to get your master's, you can put the little MSN next to your name. If you go on further, you can be a nurse practitioner. So nurse practitioners are almost like a doctor. They do not practice on the floor because they're way above that. They see their own patients just like a doctor would. They can write prescriptions just like a doctor can. They can give orders just like a doctor does. They get paid a little less than doctors, but they do a lot of what doctors do. Whenever you would see a nurse practitioner, there'll be a doctor who has to legally be over them. So if you see if your family doctor is an NP, they call them nurse practitioner, there's going to always be a doctor above them still. So there are different types of nursing that you could eventually get into. So nurse practitioner is above a master degree, above master. Then you could also be a doctorate in nurse, and they have DNPs, and you can keep going with your degrees. There's so many.
Is there any other questions?
Could I ask everybody why you're interested in nursing?
I'm gonna volunteer. I'm gonna voluntold you guys to respond.
And you can say anything. I asked my students that, and a lot of them say they watched ER on TV or something, and that's the reason why they came in. That's fine, whatever. But so just wondering what interests you guys about it.
Nashe? You want to share what made you interested in, what makes you interested in nursing? Okay. How about you, Kayla?
It's like ever since, I don't know, for a long time, I always just, always really been interested in it. I always wanted to be able to help people. I mainly want to be like a pediatric nurse, so I would help kids. But yeah, that's really, I don't know. I really like it.
That's great. So I've actually never worked with kids myself. That was one thing I didn't want to do, and most of my students do want to do that. That's a big one. A lot of them have had experience in CHOP themselves, and that's they say that's why they wanted to be a nurse, to work with, to give back to what they had. So it's great. I think pediatrics is tough. It's I always thought it would be like really sad to do that. You have to have a really big heart to do that, to work with kids. So that's great.
Would you say, how would you, as far as school goes, and students being really good in specific areas with like math and science and things like that, could you talk to them a little bit more about like the specific kinds of science and math that they have to be strong in, or know well, or be able to pick up on in order to be able to do well in a nursing program, or even get accepted into a nursing program?
So I would say all nursing programs have prerequisites that you have to have before you start the nursing program. And most of them are science based. So I don't have the list in front of me. I know chemistry, you have to have a higher level math completed too. So not just the basic math, you have to have, finish algebra 2, finish something beyond that. If we have, if we're picking between two people and one doesn't have as many sciences, we'll pick the student who's registering with the more sciences, or who has a stronger science grade. At Temple, we would pick that because a lot of the when you get into pharmacology and when you start learning about the medications and calculating them, it confuses me. But it's good to have them terms and to have that knowledge, the math and science. So we really, you'll take anatomy and physiology, they're basic ones. So that usually everybody will have that already. And then in addition to that, you would have the higher anatomy. Some people do it intro, I forget what it is now. I think it's an intro to I can't remember. It's a next level anatomy. They'll have that, the chemistry, like I said. They'll do micro. I think micro you can take when you're in the nursing program. Some students will have it come with it already taken, which is great. Then you don't have to worry about it. But not everybody. So some people will take it in the summertime during nursing program, which is fine. Other schools don't require so much. So there's so many different nursing programs out there. So some other ones might not require all the ones that Temple does. But you really do want to focus on sciences. And then also a lot of students at Temple, I didn't do this myself, but it's a great idea. A lot of Temple students will have a minor in something. So some of my students will have a minor in psychology. And so they'll have this nursing, they're going to be an RN, but then they have this minor in psychology, and it does help them. And I'm just totally impressed that they do this. I think it's a great idea. You don't have to, like I said, I didn't do that, but that's an option you have. And then I forget the other.
Social work is really a big one.
Social work's great. I mean, social workers are great. They do so much in the hospital. And when I was doing home care, I relied on them so much doing social workers. And that's a big field too. They can do, they're not just in the hospital. They're also in different locations. They're in home care. I've dealt with them so much. But, and then, the long-term care facilities, they're everywhere, just like nurses. Physical therapy is another career. I'm going off on careers now, but physical therapy is a very up and coming career right now, different career path than nursing. But that's a great career too. That's also science-based. But you can also minor in, something like extra physical exercise, or like with, physical therapy. You could do a minor in that with nursing, which is be really helpful too.
Would you say, as far as like school cost, is going into like a ASN program, is that really expensive, particularly, I guess, if you're talking about Temple or other colleges around Philadelphia? And do you know if Temple and like community colleges nursing program, do they have any like collaboration, or if or like, what is the word, transfer options as far as when it comes to the nursing? Because I know community college has a pretty good nursing program.
Mm-hmm. Yeah, so community colleges are usually cheaper all the time. They usually cost less than other colleges, and I'm pretty sure they do. I didn't look at the cost, but I'm pretty positive they would cost less than Temple too. All colleges are going to give you scholarships. So at Temple, we have scholarships throughout the year. So we're a 4-year program. So every year we offer scholarships. We offer to the freshman, we offer to the sophomore, junior, senior year. So we keep offering scholarships because people who graduated give us money, the government gives us money. So we offer that back to the students. And then there's always grant money, federal grant money and everything like that available. There is different nursing shortage. There's different nursing shortages throughout the year. So some hospitals will actually offer to pay back your college tuition if you happen to go to college during a shortage. When I went to school, it was a nursing shortage. So where my hospital I first worked at offered to pay back some of my college tuition, which was great. The VA hospital offers a great program. It's called Valor, VALOR. And they are, I'm sorry, I think that's the internship program. They offer a scholarship program too, though, the VA, for nursing students. So there's different, and so that's a government role, that's federal, the VA hospital, which is another great career for nursing. You can get a federal job. There was one in the CIA office, which I was sharing with my students, I think 2 years ago. The CIA was hiring RNs. There are different scholarships if you look out there, and we have guidance counselors that'll help you through that process.
Awesome.
Does anybody else want to share about what interests them in the medical field or nursing?
Oh, I want to be a doctor, a neonatologist, somebody who works with premature babies.
Oh, okay.
Yeah.
So we have some nursing students that actually go to nursing school, and that's their goal, is to be a doctor. But they want to do the nursing program first to get some medical experience, and then continue going on to medical school. So there are some students who do that. Some of them changed their mind and they decided just to be a nurse practitioner because they went through all this nursing school. If you want to be a doctor, it is a long, I'm not sure how many years it is long, but it's a great field. That is your goal, definitely go for it. That would be science, hit your sciences too, again. And it's a lot of study and a lot of work.
Thank you.
Mm-hmm. Does anybody else want to share about what interests them in the medical field?
How was that transition from being in law school or that, and then that's two total different, I mean, there's always connections, but this two total different worlds, like how does one even start that process to get involved, especially if you maybe you didn't have the sciences or the things that you needed, and in comparison to students that have been kind of groomed and been preparing to to be in a nursing program versus someone like you who didn't have that?
Yeah, so I did a lot of things backwards in my life, and I was not one of the students who focused at all on sciences. I hated science. I really did. I don't think I'm like great at it. I'm not great at math, and I didn't focus on them in high school. I didn't want to be a nurse in high school. That wasn't my thought at all.
Mm-hmm.
I wanted to go work in Center City at the law offices. That's what I wanted to do for some odd reason. And I ended up working for that guy. He does commercials on TV, Ranspear, the accident lawyer. I worked for him. And it was not for me at all. I mean, I just didn't like the office. I didn't like the environment with people lying. And so anyway, when I decided what I wanted to do, I had a long way to go because I didn't focus on my sciences. So I had to, I had to finish these. I felt like I wasn't old, but I was already past that 19, where everybody going through the nursing, they already were there. They already had their sciences. I was starting from scratch now in my mid 20s. I don't even know how it was, late 20s. So I felt like I was very behind, but I did it. I hit it in the summertime. I took accelerated courses. I took loans out. I didn't get, like I said, the hospital that I first worked at ended up paying for it, but I didn't get a free ride before I took loans and I was going to pay for everything myself. So I took a lot of accelerated summer courses, which are hard, and I didn't know how hard they were going to be just because it's crammed in a short time, but I wanted to get it done. Then I was on my career path. I knew what I wanted, and I didn't want to do it when I was 40. I wanted to get done like now. So I actually went to an associate degree program, which I keep telling you guys don't really do that. That was the path I took because it was the quickest to get into the nursing field. So I was doing summer college courses. I got accepted to this associate degree program. When I graduated, I kept going. So I worked as a nurse and I kept going to school for my bachelor degree. And then after that, I kept going and got my master's degree. So I did everything step by step, totally backwards. There's a lot easier way to do it than the way I did it, but I got there.
As you're in the nursing field now, what is something that you learned the hard way that you wish that someone would have told you about as you were getting into it?
That's tough. I actually heard a lot when I was in nursing school how bad I was going to be treated as a new nurse by doctors and other nurses, which I didn't find at all true. So I kind of came in expecting that, and that wasn't at all true. The one thing I think as a new nurse, I think I waited for was I was so afraid a patient was going to die on me. And I worked in ICU, CCU, which is critical care. So people are coming there who are very, very sick. And every day people die. So for me, I mean, I used to pray every day. I was like, please don't let my patient die on me today, because I didn't know what to do. It wasn't that I didn't want them to die, but I didn't know it. I didn't feel like I knew what to do. I wasn't prepared. And going through my student clinicals, never had a patient die. As a new nurse, like training with somebody, it never happened. And I always felt like I wish I had the experience before I was by myself. But as a new nurse, asks questions. I always tell my students, ask so many questions because you're new, people know you're new. So they're very willing to help you. I mean, I had great experiences, doctors and nurses who are willing to help and show you the ropes. So I always tell my students, ask everything, because it doesn't hurt at all just to get an extra hand. And people, they really do help out. Nurses, they're very nice and helpful.
So there's no such thing as a dumb question, right?
Not at all. I mean, I tell my students all the time, ask, especially when you're new, people expect you to ask questions. They know you don't know everything, and that's your excuse. Hey, I'm new. I don't know. So, and I do it myself. Like, I switched my field so many times in nursing that I was a new person so many times. It's unbelievable. So I always found the nicest person, the friendliest person, and I was like buddy with them, and I'd ask away. Even as a nurse, that I'm not a new nurse anymore, but if I'm new to that place, I'll ask questions like crazy. I have no problem.
Awesome. Great. Speaking of questions, this is the last opportunity for you to ask questions. Not really, not the last, but in this presentation. Any questions?
So, will you be emailing us, or like how will it work?
So that's up to Alexis and Tia. I think they will set it up, but what'll happen eventually after you sign, if you joined our internship, is you would come on with my group on Zoom, the students, and we would help you every week. We would meet you online. So that's going to be set up with your school. So.
Okay.
Did you all get the application link? I just shared it with you all. Not everyone at once. Yes, okay, great. All right, good. Okay. Great, thank you. All right, so it is 4:01 and I don't want to have Brenda in this uncomfortable position much longer. So thank you, Brenda. Thank you for taking the time. Thank you for sharing your personal experience and journey. It's everyone's really interested, so I'm really happy. So that's good. I'm sure you all complete your application. And so it was sent to you in this in the chat. You can complete it today. And that's it. Thank you all.
Thank you all. I hope to see you soon.
They're so quiet.
I know.
All right, I'm going to end so you guys all can leave. Thank you for attending. Okay. All right, I'm going to stop recording.